Hi, I'm Sister Anne Doyle and I'm one of the urology nurse consultants that work here at the Urology Centre Port Macquarie, and I'm one of 3 nurses that work here now, and we cover quite a gamut of treatments to patients, both male and female, predominantly to do with helping manage their bladders, prostates or kidneys. Okay, you've just been diagnosed with prostate cancer. You've obviously talked with Associate Professor Rashid, and he would have gone through the various options and treatments that may be suitable for you. But it's always nice to know that should you have questions after the consult with the doctor, that you can ring the rooms here and certainly get straight through to speak to one of our nurses, and you can voice any concerns you have, or if you need clarification of something that doctor pointed out, we'd be there hopefully to answer your questions. And if we couldn't, we'd speak with Associate Professor Rashid for you. We'd like to see you before the operation because, again, you've been given a wealth of information, and we like to go over the operation itself, what the procedure involves, side effects as a result of that operation, and we like to include things of what to expect when you go home. How do you care for the catheter that you're discharged from hospital with? Any problems that might arise with that catheter? We also like to spend a fair bit of time educating you as to pelvic floor exercises, as this is vital for your recovery as far as continence goes. And pre-operatively we'll also discuss what to expect in the area of erectile function. We don't go into detail at this time, but certainly post-operatively sometimes patients wonder why we discuss it so early, but we find that if we discuss and manage ED early, we have better recovery rates. We also like to cover things like pad advice. What do you use to contain urine loss that you may have post-operatively? Basically, we like to be a resource person for you to answer questions and to help you manage any problems that might arise. At your pre-op appointment, there are a number of things to cover. So initially, I like to just say to the patient, look, you've had a big decision to make. What plan of management have you decided on? And then we go through that plan of management with them. We will be discussing, again, the operation itself. We have slides on the computer to show you pictures of where the prostate is, how it's removed. We have pictures of the catheter, and we actually have a bag of goodies that we keep in the rooms which has catheters and bags and valves in it, and we like to show you these pieces of equipment so that you feel comfortable with them when you go home with them. We also have samples of pads that you might like to use post-operatively, and for erectile dysfunction there are a number of treatments, and we briefly go over those, which include oral tablets, injections, vacuum pumps, and then later on we would say if none of these work for you, there are implants that we could use. We like to send you off with some brochures and written instructions so that you feel quite confident with managing your care post-operatively. We've also been handing out surveys to patients to try and improve the work that we do here as a group of professionals. Okay, so you've returned for your first visit post-operatively, and today is the day that we generally remove your catheter. And one of the nurses here tends to perform that for you. We find most men very anxious and nervous about having their catheter removed, but we like to explain what we do, how we deflate a balloon, and generally the removal, although it must be somewhat a little bit uncomfortable, certainly shouldn't be a painful procedure for you, and in probably most of our cases we find that is indeed what happens for them. We like to chat with them through the procedure, we get them to cough to distract them, and then we like to move on and explain to the men what to expect that day now that their catheter's been removed. Some men will pass their urine quite normally, other men will leak significantly for a day or two, and we very much like to prepare our men for that because it can be very disappointing if they think, oh no, this is the start of the continence and it's going to be a permanent thing. Once we've removed the catheter, we like to send you home for a number of hours. We ask you to drink normally, and then you return to the room in the afternoon, and then we like to review just how your bladder function is. At this point of the day, we like to ask Associate Professor Rashid to pop in. He will advise us as to what our next plan of management is for your care, which will include coming back in around a month's time with a PSA or prostate screening test again, and we will encourage you to perform your pelvic floor exercises during that time. During that time also, Prem will discuss your histopathology, which is the report that you get once the prostate's been removed and sent to the lab, and we know whether we have completely removed the cancer. And that's always a very relieving time for you if the cancer's all removed. But in the case that perhaps a margin isn't clear, then Prem Rashid's here on hand to advise you what we need to do next. During this first visit post-operatively, there's no doubt that you may have many questions, and this is the time to voice those concerns and questions. I guess part of having a nurse here in Prem's mind is that you are able always to access information and have your concerns answered as quick as they can be, and this is a major part of our role here as urology nurses. If we can't answer your questions, we'll certainly advise you that we can get Associate Professor Rashid in directly to see you, or that we'll certainly find out for you and let you know as soon as possible. I guess what's quite unique in our role here as urology nurses is the way that Prem has set up the appointment system for us. We don't want to be rushed with patients, particularly when we're dealing with something as concerning as cancer, and we've organised that our appointments are at least half an hour. If we require more than that, then we will take the time needed to answer your concerns. Okay, you've had the catheter removed. We usually have a pad in place for you to manage any incontinence that may occur. And over the next 4 weeks, it is a frustrating time for some, particularly men. I think they lack a little bit in the patient's department, and we just encourage them that what happens over the next 4 weeks is certainly not indicative of how their bladders will be on a permanent basis. We advise our men to continue their pelvic floor exercises and to be patient as their bladder and the pelvic floor muscle recovers. Should during your time away from the office here you find that you have concerns and things aren't going as well as you'd like them to be, we're only a phone call away initially. You will be put through to one of our urology nurses here, and if we're concerned, we will organise for you to be seen that day or as we deem appropriate, and you will be seen by Associate Professor Rashid or one of his colleagues should he be away. So you've had your catheter removed, which is now 2 weeks post-operatively, and we'll organise now to see you again in a month's time, and at that visit we'll ask you to return with the PSA blood test, as that helps us monitor whether we have indeed removed all of the cancer, and it's a good time for us to be able to review your bladder and see how you're functioning in that department.